Hello, everyone. Today, let's understand an important concept in respiratory physiology called the equal pressure point, or EPP. The equal pressure point is the point in the airway where the pressure inside the airway becomes equal to the pressure outside the airway, which is the pleural pressure. P sub AW equals P sub PL. This phenomenon mainly occurs during forced expiration, such as when we cough or blow air out forcefully. During forced expiration, the pleural pressure increases because the chest wall and respiratory muscles compress the lungs. At the same time, alveolar pressure also increases, which helps push air out of the lungs. The pressure inside the alveoli is determined by pleural pressure and the elastic recoil of the lungs. P sub alv equals P sub PL plus P sub EL. As air moves from the alveoli toward the mouth, the airway pressure gradually decreases due to airway resistance. At a certain point along the airway pressure becomes equal to the pleural pressure. That point is the equal pressure point. This location is called the equal pressure point. Beyond this point, the pleural pressure becomes greater than the airway pressure, which causes compression of the airway. This is known as dynamic airway compression. In healthy lungs, the equal pressure point usually occurs in large bronchi, which contain cartilage and remain open. However, in conditions like COPD, the equal pressure point may move into smaller airways, which can collapse easily and cause air trapping. This concept is very important in physiotherapy, especially during airway clearance techniques like huffing, where we control breathing to move mucus from smaller airways toward the larger airways. So, in simple terms, the equal pressure point explains why airway compression happens during forced expiration, and how physiotherapists use this mechanism to help clear secretions from the lungs.